Hi, everyone. Today we're speaking about our own individual family's experience with FA and also the transplant process on our family. I was lucky enough to have Marina Ravallo and Marianne Lana join me up here. And we want to have a disclaimer right up front. We're not medical professionals. We're not telling you what to do. This is just our family's experience and what we found helpful during the process. My particular presentation, my son had a matched sibling donor. Our 19-year-old was the donor for our 15-year-old. Our son with FA was diagnosed at 6 months of age, and he transplanted at 10 years old. When Peter was diagnosed at 6 months old, we found it helpful to learn as much as possible about Fanconi anemia. FARF provided the best resource as far as medical information, as well as contacts for other families between regional meetings, the family meeting here at Camp Sunshine, the guidelines for diagnostics and treatment for your child. Also, we found it helpful for following other families via Caring Bridge sites, their blogs, and online information. We found out what to expect ahead of time, even though those families' journeys were a bit different than ours, but we knew what could happen along the way. And I just want to to be careful when you're searching the internet. Really look at what the source of the information is and also the date. Things have changed along the way, as whether it's protocols for a transplant, medications, and different things. If you can, ahead of time, seek treatment at a recognized transplant center. Try to get referrals from your primary care manager, working with your insurance company. And also, if you are not located geographically near a recognized center, establish a relationship between the local hematologist you're using and a hematologist who has experience with treating Fanconi anemia patients. And this isn't necessarily just for transplant. This is for any type of treatment before, during, or after. Try to adopt healthy habits within your family itself. And we found it empowering to raise money for FARF. As far as medical treatment for our child, we're kind of helpless, but you can feel a sense of power knowing that you are funding researchers maybe to develop a better treatment or a cure before your child needs it. My last tip is to appreciate every day. It's a gift with your person who has been diagnosed with Fanconi anemia, and just live life. You don't know if you're going to go to transplant, you don't know what's going to happen, but enjoy every time that you have together. Your insurance. After diagnosis with the guidelines for management and treatment of Fanconi anemia, whether you have a complicated case or a simple case, you're going to be going to specialists and getting referrals. Talk to your insurance company and request a case manager. This is one person who you can contact if you have any questions about referrals, approvals, payments, medications that are covered. It's a lot easier than calling an 800 number, getting a strange person, explaining your entire child's case, and then get referred to their supervisor or medical management start all over with that person just to answer a question. If you have a case manager, that case manager is familiar with your child and will be helpful to you. You are the best person who knows the person with Fanconi anemia. You are the caregiver of that person, and you want to get the best care that you can for your child. Even if the treatment that you are seeking is from an out-of-network provider, ask for it. You are never going to get it unless you ask. In our case, we had to go through 3 levels of approval to get to the transplant hospital that we wanted to use. We had the benefit of time on our side because he was diagnosed at 6 months and didn't transplant until 10, but it took quite a while to get that level of approval. And when your insurance company denies it, no does not mean never. Ask what the process is to file an appeal, and if that appeal is denied, ask what you can do next. Just keep bugging them until you get it. And if you have to, FARF can write a letter. Fanconi anemia hematologist whose services you're trying to provide, they can also support you in this appeal process. And sometimes you'll have to make hard decisions to keep your insurance. Whether it's my husband stayed in the military for 21 years and deployed to Iraq to keep the insurance until he retired. Some people have relocated to get jobs that have better insurance coverage. We had the benefit of time, like I said. We had 9.5 years before he went to transplant. Once we got the approval to go to the treatment center that we did, our son developed a relationship with the transplant hematologist and the hospital and got used to visiting there. And it wasn't like second home, but he knew what to expect when it came time for transplant, and we found that beneficial. One thing that I found very helpful, and still do, I've used it twice this past week. I have developed just a one-page information summary on our own child with FA. On the front, I have all of his information as far as anomalies he was born with, dates of surgeries, what type they were, any kind of surgical procedures, who the provider of that surgery was, dates, medications, dosages, you name it, it's on there. On the back of the paper, I have a huge list of points of contact. They go from who the insurance guarantor is, who carries the insurance, the primary care manager, the transplant hematologist, the local hematologist, any specialties that you use, your insurance carrier, your case manager, and when you go to transplant, usually the insurance company will give you a transplant case manager who specializes in transplant care. And your local pharmacy. It's addresses, names, fax numbers, phone numbers, account numbers, anything that you have, one piece of paper. Maybe you can put it on a smart device. In 2009, when our son transplanted, there weren't smartphones. So we didn't have that. I still carry a piece of paper around with me. If you have made the decision to go to transplant, and it's a personal decision for every family, go in knowing that the only known cure for bone marrow failure, not postponing bone marrow failure, but curing it, is a transplant. So you're going through a life-saving experience to help your child. I had asked our son Peter could he tell me anything that I should say during the lecture today? And his one thing was, be honest with your child, don't sugarcoat it. He was 10 years old, so we used age-appropriate information that was available through different books and things from the Transplant Hematology office and Be the Match. And we did little pages every night in his bedroom, arm around him, so he knew his hair was going to fall out, he knew he might vomit, he knew that the stuff wasn't going to taste good, he knew his face was going to blow up because of steroids, but he was prepared ahead of time, so much so that like on day 15, before there were other complications, he said, "Is the worst over yet?" And he had been through the chemo and the hair falling out and the throwing up and everything else, and he was like thinking that's going to be far worse. And I was like, "No, you're pretty good right now." Then other things happened, but. Try to tour the transplant facility ahead of time. Ask what the patient privileges are, the caregiver privileges, what the visitation policy is. We transplanted during swine flu. There was no one allowed but grandparents and parents at that time in the hospital itself. Your child has to live his life or her life in that transplant room. You could be there a month, you could be in there months. Try to make it as best as possible for the patient. I know it sounds silly, but Peter he started chemo on Thanksgiving Day. He was in there for Christmas. So we had holiday decorations, we had, his sheets from home, so it looked familiar, like his own bedroom, games, photographs, soft pajamas, whatever it took to make him feel a little bit more comfortable and not so sterile in that room. Then we had to get our family ready. We divided the responsibilities in the house between my husband, David, and I. He handled all the insurance questions, and he had to stay home and work and take care of our high schooler also. And I was with Peter at the transplant hospital because it was 3 hours away. We weren't together during the whole process. We decided who was going to do certain things in the house, if you're going to enlist family members to help you as far as food, take charge of the home, and also for school contacts if you have school-age children. I alerted our high schoolers' teachers, every single one of them, and said, half of the house is going to be gone for I don't know how many months, and if you see any changes in the son who's home, as far as homework, grades, mood swings. Take him aside and talk to him and let my husband or I know if there's something that we need to know about as far as him. For education for the patient, there is usually a hospital education coordinator who can help establish a link between school and your child's room, also following the same curriculum, and also can provide written support for you when you return back home, whether it's a tutor at home, an IEP, a 504 plan. There's usually a hospital staff member who can help you. I was pretty bold with our families. I said, no one's calling my cell phone other than my husband and my son at home. If I'm going to be taking care of my son in the hospital, I don't want any of you calling me. I'm one of 6 in my family, and David's one of 4. I said, I don't want any of you calling me. I was selfish, and I didn't care. And as a matter of fact, Peter thought I was on the phone too much with Dad and too much with his brother, that I was neglecting him in the room. So you can't win. Again, establish contacts with the school system, and how are you going to talk with family members via, if it's Caring Bridge or texting or whatever. I found a couple of suggestions from other families very helpful. We developed a daily activity chart for in the hospital. Peter had certain things he didn't like to do, mouth care, so he got little gifts if he did 5 of them or whatever. Tap your hospital resources. You're usually assigned a social worker and a child life specialist to the patient. And those people are tremendous helps to you. They can provide the prizes, they can provide the chart, they can entertain the siblings, the child during transplant. As for the caregiver, try to bring something for yourself when they're sleeping quite a bit. That helps relaxes you. And this one I have to say, because Lisa Anderson gave this one to me. We shaved Peter's hair before it had all fallen out, but there is just a little growth there, and so with the chemo, you get all these little hairs falling everywhere. And she said, take a travel lint brush and just roll it over his head, because it's irritating. It's falling in their food, in their clothes. They're itchy, they're irritable. And so he could do it himself, and he found it pretty funny. Seize the day. You can have fun in transplant. Believe it or not, we had food parties every Friday, worked with a dietitian. Sometimes she had to be in gloves and masks. And also, there's different things. The child life specialist gave our son a Nerf gun to shoot the medical team who was rounding in the morning when he was mad and wanted to be discharged. So he goes, if you don't let me out today, I'm shooting you. And he did. There are complications even with a sibling donor, just be prepared for that. We were home on 85, a year later, reimmunization, and transplant affects everyone in your family. Next up is Marina Ravello.